Want to pass your CCRN exam? Then let's get started. Today we'll be covering 10 questions based on the cardiovascular system. Question 1. A patient in the ICU is receiving dobutamine for acute heart failure. Which assessment finding indicates a positive response to the medication? Decreased urine output, increased heart rate, decreased blood pressure, improved level of consciousness. Pause the video and select your answer. If you chose option D, you are correct. Improved level of consciousness. Improvement in the level of consciousness indicates improved tissue perfusion, which is a positive response to dobutamine therapy in acute heart failure. You can pause the video and go through the incorrect options. Question 2. Which medication is commonly administered to a patient experiencing AFib with rapid ventricular response in order to slow the heart rate? Amiodarone, furosemide, atropine, digoxin. Pause the video and select your answer. If you chose option D, you are correct. Digoxin. Digoxin is commonly used to control the heart rate in patients with AFib with rapid ventricular response. Question 3. Which hemodynamic parameter is an indicator of left ventricular preload? Cardiac output, pulmonary artery pressure, pulmonary capillary wedge pressure, systemic vascular resistance. Pause the video and select your answer. If you chose option C, you are correct. Pulmonary capillary wedge pressure. PCWP is a measure of left ventricular preload, reflecting the pressure in the left side of the heart at the end of diastole. Question 4. A patient with acute MI is experiencing VFib. What is the priority action by the nurse? Administer epinephrine, defibrillate immediately, perform synchronized cardioversion, administer amiodarone. Pause the video and select your answer. If you chose option B, you are correct. Defibrillate immediately. VFib requires immediate defibrillation to restore normal sinus rhythm and improve the chance of survival. Question 5. Okay, guys, we're halfway there. Which assessment finding in a patient with pericarditis should the nurse report immediately? Jugular vein distension, muffled heart sounds, presence of friction rub, elevated ST segment. Pause the video and select your answer. If you chose option B, you are correct. Muffled heart sounds. Muffled heart sounds may indicate cardiac tamponade, a serious complication of pericarditis, and require immediate attention. Question 6. A patient with heart failure is prescribed spironolactone. Which laboratory values should the nurse monitor closely? Sodium, potassium, calcium, magnesium. Pause the video and select your answer. If you chose option B, you are correct. Potassium. Spironolactone is a potassium-sparing diuretic, so monitoring potassium levels is essential to prevent hyperkalemia. Question 7. A patient diagnosed with cardiogenic shock has cold extremities and diminished pulses. Which intervention should a nurse prioritize? Administering IV fluids, initiating vasopressor therapy, placing the patient in Trendelenburg position, administering a beta blocker. Pause the video and select your answer. If you chose option B, you are correct. Initiating vasopressor therapy. Cold extremities and diminished pulses indicate poor perfusion, and initiating vasopressor therapy is necessary to improve systemic vascular resistance and blood pressure. Question 8. Which diagnostic test is most appropriate for confirming the presence of an aortic aneurysm? Echocardiogram, CT angiography, chest x ray, coronary angiography. Pause the video and select your answer. If you chose option B, you are correct. CT angiography. CT angiography provides detailed images of the aorta and is the preferred diagnostic test for confirming the presence of an aortic aneurysm. Question 9. During a code blue, which action should a nurse take to minimize the risk of myocardial ischemia in a patient receiving chest compressions? Administer nitroglycerin, provide supplemental oxygen, perform rapid defibrillation, rotate chest compressions every 2 minutes. Pause the video and select your answer. If you chose option B, you are correct. Provide supplemental oxygen. Providing supplemental oxygen during chest compressions help improve tissue oxygenation and minimize myocardial ischemia. Question 10. A patient with hypertrophic cardiomyopathy is prescribed verapamil. Which assessment finding indicates a potential adverse effect of the medication? Bradycardia, hypertension, decreased urinary output, peripheral edema. Pause the video and select your answer. If you chose option A, you are correct. Bradycardia. Verapamil, a calcium channel blocker, can cause bradycardia as an adverse effect. Click that subscribe button and join us next Thursday for another CCRN Thursday.